the COO at the PCPCC, and we're excited to have you all here today with us. We've got a really great lineup of speakers for you and some exciting information that's just up and coming. So I'm glad that you're all able to join us. And before we get started, I'm just going to start off with a few announcements. I think all of you are probably aware that we're going to be having our annual conference for the PCPCC here in Washington, D.C. this November 12th through the 14th. I'm hoping that all of you have already registered, but if you haven't yet, we do still have early bird registration fees available until the 26th of September. So I know all of you are very cost conscious at your organizations nowadays, so I encourage you to go ahead and get registered for that conference. We hope to have you all there. We are going to have one of the most extensive programs that we've ever offered before. So it's 3 full days of programming, and I know you're all really busy and lots of places to go, but this is kind of one-stop shopping where you get to see all your colleagues that are interested in improving primary care, from employers and payers to, of course, many, many clinicians who are doing this in their practice. And not to mention, not to say for last, but actually most important are our patients and family leaders who are going to be participating in our conference as well. So again, I encourage you to go ahead and sign up for that. You can do that through our website. We also have our monthly briefing that takes place next Thursday on September 25th, and that's at 1 p.m. Eastern. We're going to be featuring the Bipartisan Policy Center's latest report, which is Building Better Health, Innovative Strategies from America's Business Leaders. Many of you were probably participating in their briefing that they had just this past Tuesday. They had incredible turnout, and it's just really exciting to see all the great energy and effort and resources that our private sector is putting into improving the health of the population. I mean, they really understand and appreciate that it's not just for the betterment of their employees, but for their families and for their community as well. So I encourage you to go visit that as well. So many of you have more than likely been a part of our webinars before and are been on part of our webinars. In just a minute, I'm going to turn it over to our CEO, Marcy Nielsen, to introduce everyone. But just to let you know, we're going to do the presentations first, and hopefully you're all online and you're able to see the slides. If you have any questions for our speakers during the presentation, you can type them into the little chat box. There's a question chat box there, and we'll be asking those questions at the end of the presentation. So there'll be plenty of time for us to have some Q&A. You're not able to do it by audio, so you'll have to type your questions into the box. Most of the time we're not able to get through all of the questions, but we'll do the best that we can. And if you have any further questions that don't get answered, you can email them to one of the staff here at the PCPCC, and we'll direct those as appropriate. Just to let you know, if your colleagues are not able to participate today, we will have the recorded presentation up on our website in the next 24 hours, along with all of our other past webinars. So we encourage you to visit the website and share that link with your colleagues and friends. So now I'm going to turn it over to Marcy Nielsen, who I believe has joined us.
Thanks so much, Amy. Can you hear me all right?
It's pretty faint.
Okay, so let me try. That's any better?
Much better, much better.
Okay, thank you. Sorry about that, and thank you everybody for your patience. I am in Wisconsin today. I just wanted to introduce our 2 guest speakers and thank them for joining us today, and thank all of you for being here. It is with great pleasure that I introduce the adorable Melissa Thomason, who is the committee co-chair and patient and family advisor for Vital Health. She was the committee co-chair for this NQF panel that she's going to tell you about. She is an amazing human being, a real inspiration, and you can no doubt on the webinar description see a little bit about Melissa's story. I'm going to let her tell it herself. I would just tell you that we are thrilled she's going to be joining the PCPCC at our fall conference in November and be delivering a keynote about some of her experiences and what she's learned that can help all of us into the health system. She is 28 years old, and as a first-time, at 28 years of age, she was a first-time mom to be a public school teacher, which you will hear in her voice, and she suffered a very serious aortic dissection, and all of the health repercussions of that have turned her into an amazing activist for the voice of the patient. So, Melissa, thrilled that you are here and will join us in November. And then also want to introduce Rob Saunders, who's the Senior Director at NQF, the National Quality Forum. He works on a number of important projects there around measuring affordability and advancing engineering. He actually been at the Institute of Medicine before he came to NQF, and he was the study director for the IOM's Best Care at Lower Cost, and has an amazing background being a researcher at Duke, starting in physics, and then later a postdoc fellow in the Department of Radiology, and he's adjunct faculty right now at American University teaching health policy. Also worked for Congressman Rush Holt. So with that, I'm going to turn it over to Melissa and Rob and thank them again for joining us and all of you for being with us.
Thank you, Marcy. So as Marcy gave me all of these compliments, I must say I enjoyed working with Marcy so much on the NQF panel, and she is just as much an amazing human being. In fact, when I was so overwhelmed by the entire NQF experience when I got there, it was so encouraging as a patient to see so many compassionate people in a room who were so concerned with hearing the patient voice. As Marcy said, my name is Melissa Thomason, and I am 34 years old now. So just about 5 or 6 years ago, I was a public school teacher. My life was right on track, it was exactly like I'd planned it. And my husband and I decided that we were going to have our first child about 7 years into marriage. And then my whole world turned upside down. I was 28 then and was 35 weeks pregnant with my son when I was hospitalized for preeclampsia and got in the hospital shower 2 days later, and my aorta ripped open from top to bottom. I remember my jaw clamping down and the horrible pain that followed. They did an emergency C-section, and my son was healthy and is doing well today. But I am a different person now. I had my first open heart surgery that night. So I had a C-section that morning, open heart surgery that night. And I remember sitting in the hospital bed about 3 weeks into that open heart surgery stay. And I looked at my husband, and he's a salesman. I'm a school teacher, and I told him, we will never, ever be able to pay this off. We will never pay these bills off, honey. We will never have a house. We will never have, Nathaniel's not going to go to college. I was so overwhelmed by the idea that I knew these health care bills were waiting for me when I got out of the bed. And I didn't know anything at that point about insurance maximums or any of that. I knew that we paid for medical insurance every month, but as an otherwise very intelligent, very informed person, I had no idea what all that meant in the real-world application about what I would have to pay when I got out of the hospital. But I did. I got out of the hospital. The bills started arriving, and we started setting up payment plans. And then I was diagnosed with a severe aortic aneurysm and went back into the hospital for 2 more open heart surgeries that same year. So 3 open heart surgeries in a year. And it took its toll on my family beyond what I can explain. My mom moved in with me. It changed us for forever. You'll never be the same person after all that happens. But I like to think we're the better for it. I also know, jokingly, we say we are the better for it and we are the broker for it. Because we do. We still pay those medical bills every month. And we live under a heaping debt of medical bills. And we're very aware of affordability and what that means to us every single day of every single year, because even when I'm completely healthy, I have to have diagnostic tests and things like that done. So I inform myself, and it matters to me very much as a consumer now that my healthcare workers take into account affordability and what it means to me and have those conversations with me. And then more than that, eventually I would love to have access on a broad scale to quality information so that I can pick valuable health care. I don't buy a book, I don't buy a toy for my son without comparing that price and its value and the quality of the product and all those things before I buy them. I don't buy anything without doing what I call smart shopping. And yet every year I have CT scans and MRIs and lots of stuff that I don't know if I'm getting the best, quote-unquote bang for my buck. I just know I'm being scanned by my doctor because he told me I needed to be. So I want to have those conversations as consumers for sure. When I was invited to join this panel, it opened up the conversation. And I was pleased beyond measure from day one to participate. And Rob, as Marcy introduced before, will walk us through what we learned at our in-person meeting and a lot of what we'll take away from there.
Great. Thanks, Melissa. And I think it's important, Melissa's story really helps to center the conversation and really helped keep this project really focused on what matters, which is how does affordability matter to patients, and taking it away from the conversation that sometimes happens, which can be very abstract and talk about statistics, to the fact that affordability is really matters to patients' daily lives and can have a really strong impact on how people live day to day. So I'm going to sort of go through some quick slides here. We sort of already introduced everybody, but today's presentation is really going to talk about 5 different topics. We'll talk about why InQF did this work to really think about assessing affordability from the patient perspective, and I think Melissa's story puts it in really think about how this type of work relates to other work on measuring healthcare costs and affordability, what we did, what we learned, and then what we can do next, and how we can all play a role in trying to improve the situation. So let's jump right into the why. And there's a variety of statistics we can trot out about why affordability is a big problem. I'm sure most of you have seen a lot of these statistics, whether it's about the amount of the economy that is going toward healthcare, or really even the amount that people's health insurance premiums have increased over the last decade, or their out-of-pocket costs. But really what that means to patients and consumers is that they're shouldering a lot of higher healthcare costs, and they're trying to make decisions based on cost and quality and asking questions. But are they able to do so? I mean, do we have the supports out there? Is the information available? Have we set up a system that can do that? And it's really important to think about this not abstractly, but how this actually plays a role in people's lives. So then to jump forward, how does this relate to other measurement work? And really what this project did is it really set a baseline, it set a foundation for how we might think about other types of measurement. And we sort of show a slide here of just how we move from setting goals and priorities all the way to how we use measures. And this project really grounds sort of the future work on how do we think that measures should be developed and tested and endorsed and selected so that people have the information they need, and also that we're encouraging affordability across the board. So how did we do this work? We brought together a variety of folks from across the healthcare system with a large number of patients and consumers, Melissa being a prominent co-chair and Marcy being on the panel as well, but also folks from health plans, physicians, nurses, researchers, and the like. And I'm going to flash up our panel list just to give a sense of the types of people that were involved. But it's a relatively wide-ranging panel from a wide variety of parts of the healthcare system and from a wide swath of the country that really thought together deeply for about 2 days on what is affordability from the patient perspective and how do we help patients as they try to find affordable care. So let's jump quickly to what we learned. And so the big thing that we learned is that affordability has to be, in healthcare in general, has to be taken in context, that it can't be considered as abstract from a person's life. That is one part of a person's life. And if we're talking about trying to improve affordability, we need to look at what else is going on, so that if we're asking people to drive, say, 20 minutes to a pharmacy that might be a little bit cheaper, well, how does that relate to the fact that they may need to suddenly deal with child care expenses and deal with their child, or try to take one of their kids to a soccer game? Or how does this person who just started a new project at work take off several hours in the middle of the day to try to go to a different specialist, or a specialist that's far away? That all of healthcare sort of has to be viewed in context from what a person's daily life is. And that not all of healthcare is the same, that there's different types of decisions being made there, and there's going to be different, affordability differs for those different decisions, whether it's buying insurance, whether it's dealing with an acute condition like somebody has bronchitis or breaks their arm, or whether it's a very serious illness that can even be life-threatening, and that people are going to view affordability differently in those situations and need different information and different supports as they go on. And so we sort of walked away with 3 big take-homes from this, one of which is that affordability really starts with out-of-pocket costs. So how much is a person paying toward their premiums or their deductible or their co-pays and co-insurance and the like. But that's not the end of the story. And as Melissa put it nicely, it's not about buying low-quality care at low cost. It's about trying to find high-quality care at low cost. And that feels intuitive, but that has a lot of implications for how we might think about affordability. That's not just the simple dollars and cents of a medical bill, but it also matters with how the quality of the care that's delivered there. It matters with indirect costs, so how it affects other parts of a person's life. So as we mentioned earlier, if we're asking folks to travel out of their way to go to a specific physician or a clinician or a pharmacy, is that going to affect other costs that they're paying in their daily lives, whether that's child care expenses or time away from work, or having to juggle things around so they can make sure their kids get to the things they need to get to. We talked a little bit about how things differ for different health decisions, that it's very different to talk about affordability in, say, buying insurance, where somebody might be able to sit down in front of a computer one night and calmly look through a list of options and weigh different benefit plans and different premium costs, although there's clearly a lot of subtleties there, as opposed to a life-threatening condition where you need to get medical care right away, and cost takes a very different tone in that situation, where you're simply trying to make sure that you get the care you need to stay healthy and stay alive. And a big piece that came up is affordability doesn't really make sense unless people are able to navigate the healthcare system. And the fact that it's very hard to navigate the healthcare system now and understand what options you have and that you even have options, and to get to those options and to move between the different parts of the healthcare system obscures a lot of this sort of easy talk about affordability. That's easy to say, well, we can compare different options and we can shop around, but if a person doesn't even know that they can shop around or doesn't even know what options they have, it's very hard to ask them to be an educated consumer, and people don't necessarily have the resources they need right now to navigate the system and to make those types of decisions. So we put together a quick little infographic that shows some of these questions. Next slide, please. And just to note that one of the key parts of this navigation function is that you have to know what questions to ask. And oftentimes, people don't even know what questions to start with when they're trying to find affordable care. And then we need to think about how we can tailor things to people's situations and to the specific healthcare decision that they're thinking through. And so finally, how can we move forward? We've sort of we've talked about how this project worked and where it came from and what we learned, but how can we move forward and make the system better? So one of the things that we did in this project was try to identify the barriers that are keeping people from being able to search for and find affordable care. And I put 5 up here right now, but there's clearly a few more. But these represent some of the biggest that were identified. So one of the key things was the difficulty in just navigating the healthcare system, and I think that's particularly appropriate for this audience from the PCPCC, as there are different ways that we can support patients as they're trying to navigate the healthcare system, and advanced primary care and medical homes and those types of models are certainly one way that we can really help patients as they're trying to navigate their different options. Another barrier that Melissa brought up, but one that isn't thought about very much, is the confusing world of healthcare billing can really make really prevent people from thinking about affordability. And it doesn't matter how educated the patient is, if they receive a slew of bills from the hospital, say, not only the hospital bill, but maybe the substitute bills of the anesthesiologist or the radiologist, or if they go to different specialists afterwards, getting all of those different bills. And frankly, most of those bills can be almost incomprehensible for many patients. And the fact that they're uncoordinated means that the patient then has to think about how each of these bills work together. And if you set up payment plans, those payment plans are each going to have different monthly minimums that they're trying to juggle around. And this all makes healthcare seem a little bit less affordable and makes it harder for somebody to really access affordable care. Melissa noted one of the big challenges is just the lack of transparency. And that's not only in terms of price and cost, although those are clearly a problem, but really also an issue in finding out about quality and meaningful, usable information about quality. It's not just any information about quality, but information that people can use that applies to their particular situation and also allows them to make decisions. And then also making sure that information is tailored, that people don't want to know necessarily about a generic patient. They really want to know about how this affects their particular circumstances and their particular conditions and their needs. So as we go through, it's clear that while this project talked about the patient and consumer perspective, really changing the situation will require help from everybody. That's employers and health plans and clinicians and others to really make a difference. And the panel spent some time thinking about where further action might take place and what that might look like. And here are four. There's a few more in the final white paper, and we'll share that with the PCPCC staff, and that will be included in the follow-up email tomorrow. But one of the first ones is helping to increase the patient-clinician conversation. That many patients are looking to their physician, their nurse practitioner, their clinical professional to help them think through cost and affordability and think through what the different options are. And that's not necessarily a conversation that clinicians are trained for, that they're used to having, or that they even have the resources to have. That oftentimes a clinician may not know what the negotiated price is for a particular option, because it depends on a person's insurance status and where they are in their out-of-pocket maximum for the year and the like. But it's clearly something that patients were interested in having the conversation about. And it's also something that we're hearing patients are increasingly asking questions about. And so making sure that clinicians have the resources they need to be able to have those conversations is an important next step for improving the ability for patients to find affordable care. One of the next big pieces is just increasing transparency overall in terms of cost and quality, so that patients can find the information they need, whether that's having the conversation with clinicians or whether that's just on their own. But improving transparency overall is an important piece. We also discovered just the resources that patients themselves are, and how a patient who's gone through a very serious medical condition can be an incredible resource for other patients that are just starting to navigate the system, and helping link those patients together so they can serve as a resource to other patients can really be incredibly valuable in helping them think through the practical realities and the practical questions to ask, from is this physician practice open late at night so that I don't have to go to urgent care or to the emergency room, or do I need to ask about how this practice may work with other practices or the specialists that I'm thinking about, just thinking through those practicalities. And then finally, another piece that was brought up, and Melissa, I think, demonstrated this nicely coming from her educational and teaching background, is that there's a clear role for our educational system in helping patients think about not only just health, but also health benefits, and what do health benefits mean in terms of health insurance, and how do you use your plans, and how do you understand these many terms that are thrown at you. And there's a possibility to integrate some of these concepts early on so that people can try to learn very early how to shop around, how to think about healthcare, how to use healthcare. So let me stop there. And I want to turn things back to Melissa to see if she has some closing comments, and then we want to open it up for questions and discussion.
Oh, Melissa, we can't hear you. You might be on mute.
Okay, I've got it now.
There you are.
Very good. Thank you, Rob. Rob did a fantastic job here on this line and then, too, in Washington, D.C., of summarizing the views of everyone at the table. And one of the things, too, that I wanted to point out today is for providers, I co-chaired with Dr. Elizabeth Mort. She is a fantastic patient champion and an incredible, compassionate person. And in the middle of our first day together, Dr. Mort looked at me and she said, I never considered that. And we were having a conversation on really appropriateness of care. So for me as a patient, one of the first questions I ask myself before seeking care is, if I need it, do I need to be seen, particularly for emergency room visits and things of that nature. My brother recently, as I was telling them in D.C., ended up in the emergency room, and he calls me because I have so much medical history. He says, do you think it's serious? Do you think I need to go? And I was like, well, tell me what your symptoms are. Well, maybe you should go just to be sure. And he's saying, but you know how much it's going to cost at the emergency room, and I can't have all these medical bills if something isn't wrong with me. And finally, he ends up going to the emergency room, and he asked me if I would come with him. And we're walking into the front door of the emergency room, and he looks at me and he says, for what I'm getting ready to pay, something better be wrong with me. And it was almost, it's one of the only places you end up as a patient where you're almost hoping something is wrong with you to justify the amount of money you know you're getting ready to spend just by visiting the emergency room. But that I'm not a provider. I don't even know if sometimes when something's going on with me, if I need to seek care. The morning my aorta dissected, if I hadn't been in the hospital already, I hope that I would have gone to the emergency room, but I can't tell you for sure. And even having providers or information available to consumers in general to help us answer those questions would be a big help. I also want to point out, too, as a consumer, it is important to me what I spend out of pocket. It is. What comes out of my pocket affects my life, affects our budget. It affects our real-world reality, okay? It affects what my son gets for his birthday and the vacations we can take during the summer. It affects our lives. But more than that, I care about what comes out of my pocket, but I care about our healthcare system as a whole. And I want to know that we're using our money efficiently and that we are, as consumers as a whole, making informed decisions and doing so with care, because I recognize that the system as a whole has to be successful for my own insurance premiums and my own out-of-pocket expenses to be successful as well, for me to have success. I know that success as a system as a whole is important, and I know as a consumer I'm willing to work toward that. I want to point out, too, that it is important to me to have affordability conversations. And we had several providers at the table who said very candidly, I'm not prepared to have those conversations, as Rob pointed out earlier. And I guess I would say if you're not prepared as a provider to have the affordability conversations, it's okay. But find me someone who can, and then team up with them. And you give me my medical options, and let them give me my financial options, and then let's employ shared decision-making to really make a good decision for my life here. So I have to have the conversations, and recognizing that and setting up a system so patients can have those conversations, I think is important. And then at a national level as well, if we're going to have these conversations on affordability, I think it's important to include all stakeholders, and patients have the most always to lose and gain. I think they have to be at every table where decisions are being made about care in general. I think that affordability should be part of the patient-family-centered care conversations that we're having. I believe in having conversations about affordability as much as I believe in things like bedside shift report and shared decision-making and motivational interviewing, because it affects my reality as much as any of those do.
And I think this is a great time to turn to questions and discussion. The organizers can help us open up the line to see if folks have thoughts that that people want us to answer or to discuss in more detail.
Great, great. This is Amy again. Thanks so much, Rob and Melissa. Excellent presentation. And just to remind everyone, although you can't ask the question over the audio, you can type in your questions to that little question box that's on your dashboard. So we've got a couple questions in the queue already, but I encourage you to go ahead and type those questions in, and we'll get to them as quickly as possible. And I can already go ahead and warn you, Melissa and Rob, these are some tough questions that are coming in. But just to kind of kick it off based on where you were ending the conversation, Melissa, so much of this goes back to what's the comfort level of both the providers and patients and caregivers in having these conversations. And maybe I'm kind of going out on a limb here, Melissa, but I think you might be more of the exception than the rule. I'm guessing that a lot of patients and families don't necessarily feel comfortable asking their providers about cost, or even bringing up the subject about whether or not they can or can't afford a particular treatment that's been prescribed to them. What are some recommendations that you have, or some ideas in ways that we might help patients and families be more comfortable in asking those questions and having those conversations?
I think that's a great question, and I'm going to be honest with you. I know that some patients, and really some providers, are uncomfortable with the term frequent flyer, but I'm okay with it. I mean, I've been a frequent flyer in this system for 5 or 6 years now. I seek care regularly, and I have to have it. But even I, to this day, am still not comfortable having some of these affordability conversations, because I think the traditional healthcare sense of the physician or the provider is the authority, and I sit there quietly and listen to them. It's hard, even sometimes for me, to ask the tough questions about my medical care. And affordability is even more so, because you think, well, maybe I shouldn't ask this, and it's hard for me even. So I think that physicians bringing up those topics and saying, would you like to have a conversation about how much this costs? Or would you like to have a conversation? And offering me an invitation to speak up and to have those conversations is vitally important. My primary care physician before walked me through 3 open heart surgeries and was incredible. And she spoke candidly to me about all of it. And October would roll around and she'd say, you've already met your insurance max for the year. We need to do this, this, and this before end of year. How do you feel about it? And I would say, I feel like you understand me and you understand where I'm coming from. And we work together. So I think it's important for providers to raise that question sometimes and to broach the subject for sure. It's hard. It's hard to talk about as a patient.
Yeah, I think you're right. I think it is also within the context of just that trusted relationship between patients and families and their whole provider team, but making everybody more comfortable. And I think one of the ways that we can do that is arming people with better information. And Rob, you talked about the kind of movement to trying to make a lot of this information more transparent. I mean, it's certainly confusing as all get out for most patients to understand the bills that they receive and even understanding their benefits through their insurance. But as you mentioned, quite often the providers don't have access to this information either. Many of them are employees of a health system. They're nowhere close to the process of negotiating contracts with various providers. So can you give us a little more information or some insight as to what might be happening on that front and ways that people are starting to get access to that information so they can be armed with the tools and information that they need to have these conversations?
And that's an excellent question, and I think we're just starting in that front, and I think that was one of the reasons why this project really wanted to make the pitch that it's not just the providers having this conversation, but in order for the providers to have this conversation, there's a prerequisite of supporting them and making sure they have the information they need. I mean, there are projects that are underway right now that are trying to improve transparency across the board, and that will have the added benefit of providing that information not only to patients, but also to providers as well. But clearly more work needs to be done. So I think there's a starting point. There aren't necessarily practical answers right now for how to make sure that providers have information on, say, negotiated price, or how to even look at how this might work in terms of a patient's current history in terms of out-of-pocket costs and out-of-pocket maximums. But there is at least some movement that's taking place. So, which is not the best answer to give, and that we'd love to see. It would be great if we'd see more progress, but at least there seems to be an interest and appetite in helping provide more information across the board, and hopefully that will spill over to make sure that providers have that information as well.
Yeah, I totally agree. I think we still have a long way to go in this vein, and I think not only the actual cost of various procedures or providers and all that goes into that, but you also mentioned that there's other things that need to be factored in. There's the quality and having more transparency around metrics in terms of the quality of the services that are being provided alongside the cost, and then the issue of access. So we know that there's different restrictions sometimes with certain types of health plans in terms of narrow networks. Maybe, Melissa, you want to kind of think or give us some of the thinking that goes into how you make decisions for you and your family when you factor all of those various elements in. And Rob, if there's any other information that you can share specific, maybe even to just the NQF, around how you're weighing all of those different metrics as it goes into transparency and information related to healthcare at large.
Sure. I will point out, too, that for me as a patient and then the other consumers in the room, as we had our in-person NQF meeting, my decision-making varied based on my circumstance at that time. So when my aorta dissected out of the blue, and it was an emergency and my life was at stake, and that I looked at my husband and said, how will we ever pay for this? And he looked at me and said, it does not matter, get better. Because when our life is at stake, our perspectives of what is affordable shift suddenly and dramatically. I will pay whatever it takes to stay alive. So in emergencies, you obviously, for me, it wasn't a matter of affordability. But now, in elective procedures, or what you would call more day-to-day routine procedures, obviously I want access to information. I want to know if you're a hospital, like IOM's 2001 paper on what is quality care. So I want to know if your facility is safe. I want to know the number of days since your last serious safety event. I want to know if this physician has done, my entire aorta is replaced top to bottom. So I want to know if this physician has done other procedures like this. I have a very rare genetic disorder that actually transferred all of my care after first open heart surgery to a facility that had done more procedures like the one I needed. So I want to know if they've done them. I want to know if they were successful. I want to know if they have patient-centered care. I want to know if my family is going to be able to visit me in ICU, things like that. And I feel like I have no access to that information. And it is so frustrating as a consumer. And then, as I raised before, I don't always know if it is elective or emergency. And there's the fear that, is this an emergency? Is this chest pain I feel real? Is this a heart attack? Do I need to go now? Do I need to pay more for help now? Those questions are so hard to answer and so scary as an average consumer with no medical training.
Yeah, I think you're right on, Melissa, even in terms of just understanding what the treatment, not only what the treatment pertains to, but how emergent is it? How quickly do you need to make these decisions? Like you said, even going into the emergency room and trying to weigh whether or not you need to be there versus the cost. I mean, these are all decisions that patients have to make, sometimes turning on a dime, and I think it certainly complicates the issue. But Rob, I don't know if you know this specifically. We got a question about where we can direct patients and consumers to get more information about the cost of care. And I certainly know that there have been several movements by health systems in various communities to put on their website kind of calculators for costs of care for maybe more elective procedures, or certainly I even remember when I was pregnant with my second daughter and going into the OB-GYN's office, and it wasn't the OB-GYN who came to visit me first, it was a billing clerk who came to visit me, and she laid it all out, exactly how much it was going to cost beginning to end until I delivered that baby. So, what's your recommendation for the consumers to look and try to get some of this information as they're starting to get more engaged in these conversations?
And that's a great question, and there are some organizations that are trying to do this. On the employer side, there's a variety of employers who are thinking about specific tools. Some are using homegrown tools. There are also some proprietary products out there now that are being provided for employers, especially for self-funded plans, but just in general, there's some movement there. And a lot of our health plan representative on this panel noted that most health plans have started to provide some type of calculator for their beneficiaries on what things would cost. But we also heard about some national organizations that are trying to start things, from the Healthcare Costs Institute to Fair Health to a variety of others, who are trying to offer national estimates of what is care cost for particular procedures. I think, going to Melissa's point, one of the struggles here is really making sure that that information is put into a form that is useful, and it's going to depend whether it's a procedure that is totally elective and that there's not much time sensitivity to, and that one can really sit down and think and make an informed decision, versus a very emergent procedure or a very life-threatening procedure, life-threatening condition where that there just isn't time to do that type of shopping around. And also whether there's the ability to look at things in terms of episodes, where, say, for having a child, that you can look through the entire OB/GYN obstetrical process from beginning to end, versus are you just looking at different CPT codes. And patients can't necessarily understand, well, which CPT code am I going to need for this particular condition, but the ability to look at episodes of, well, if I have this condition or this type of procedure, what is the likely range or estimate of what I need to pay? So there are some things that are coming out from the employer community, the health plan community, some national organizations as well. Some health systems are doing this. And there are, I see in the questions list, some state initiatives that are underway in order to provide this information. We had the Minnesota Community Measurement as one of our key panelists at this meeting, and they talked about work that they're doing on trying to provide estimated costs. But in terms of nationally, it's a patchwork, and it differs for different situations.
Yeah, again, I think there's a lot of work that's being done in this area, and as Melissa said, we've still got a long way to go in terms of making this information universally accessible to people in a way that they understand. We do know that there are some other types of kind of campaigns and initiatives that are ongoing and really trying to engage patients and consumers in the process of understanding, what procedures are necessary and what they cost, and really having them as partners at the table in improving our overall healthcare delivery system as it relates to, like Melissa said, making it more efficient, using our resources in the best way. And one of those that was mentioned in the Q&A was the Choosing Wisely campaign. And I don't know, Rob or Melissa, your familiarity with that campaign, but the idea that we provide information to clinicians about what's appropriate in terms of, clinical decision pathways and procedures, common procedures, things that are maybe necessary in certain cases, but for the most part, for the general public, they might not be as important to have. And then, some that are very evidence-based. Clearly, you should not be ordering these particular procedures unless you have a special circumstance. Maybe, Melissa, you can speak to just the whole idea of engaging patients in that kind of conversation. I think, in my personal opinion, I think it's really challenging to ask patients to kind of bring that information to the table. I mean, like you said, most providers are used to, providing a prescription or giving a treatment and just anticipating that their patients will follow through on that. I think it's a whole other milieu that you create, and it's very challenging to create an environment in which patients really feel empowered to say, I'm not sure that's the right treatment for me. What are your thoughts about that, Melissa?
I think we need to look at, well, really, I think we need to look at lots of issues beyond affordability in this scope, but particularly affordability along the entire continuum of care. So I personally do not think that it is only my provider's job to have this affordability conversation with me. I think like everything else, and like with health literacy as a whole, and with educating our patients and things like that, that these conversations have to be had along the continuum of care. So I want my providers to be able to have these conversations with me, to at least direct me to where I can find more information if I want it. Health coaches and community health workers, and as we work to make our society healthier as a whole, I think we have to keep this affordability conversation on the forefront of that. It cannot be a more expensive option to be healthy and it be something we're going to achieve. It just can't. We have to have these affordability conversations, I think, along the entire continuum of care. And as I said before, I want my physician to be in on the conversation, because I don't just need to weigh the costs. I need to weigh the cost of the treatment and how he says I need it or it will affect me. And then I can use all of the information together. So I want him in on the conversation, but I'm not saying that I put the entire burden of affordability conversations on providers. I think they already have so much on them. And really fast, I will say, I had a friend that she truly wanted to try comparison shopping and had to have a small procedure done on her foot. So she called local providers, and she asked about this particular procedure and said, can you tell me how much you guys charge for this? Because it was going to be the same everywhere she went. She knew that. It was a very simple procedure. And she got asked repeatedly, what is the ICD code for that? and we have no idea. We're patients. I have no idea what the code is. So it's something that it's a conversation that not everyone is comfortable with yet. But I hope it becomes a conversation that literally everyone along the continuum of care can help me with as I experience care through every phase.
Yeah, well, Melissa, you bring up another good point, I think, that often we're not even speaking the same language. So we think we're asking a question that should have a real simple answer, and then from the provider side, they come and ask us something that is completely foreign. So I think that the larger spectrum of how we have these conversations within the healthcare system between patients and providers is key to a lot of this, and being realistic about those expectations as well. So I think you're exactly right there. I mean, it's not always a simple answer, when patients think, oh, it's this exact procedure. It doesn't matter where I get it per se. I just want to go and cost compare, and you're going to get, a dozen different answers based on, all kinds of various factors, the type of facility, the type of contracting, and who the payer, I mean, there's so many things that go into it that I think that patients don't understand. So it's trying to strike that balance between everyone being at level set to have a reasonable conversation about these issues without the expectation that everyone's going to be an expert in this as well. I think I think that those are really tough issues to try to balance, but I think we certainly need to go a lot further than we've had in the past in terms of making that happen. I think that's important. Rob, do you have any other particular suggestions in terms of how we can help the provider community better engage on this front and working with patients in a more collaborative way?
And that's a good question. I think the example that you brought up, the Choosing Wisely campaign, is notable for the fact that it's not about necessarily saying a procedure is right or wrong, but saying that for a given set of procedures that these are worth having a conversation about, and it's worth bringing those up with patients and having it and starting to have that conversation about risk and benefits and what this really might mean for your condition and for your overall life. And I think that's sort of a very similar analog to what Melissa describes, which is it's not that we're going to have all the answers right now, and we know that, and we've discussed how the supports just aren't there right now for the provider community to have a full and in-depth conversation about every aspect. But there's more that can be done. And knowing that questions that patients are going to start asking questions about affordability and are going to start having to think through, well, how do I start to weigh these different options for my plan? That's something to just be open to the idea that that's going to happen, and perhaps even start to engage in a little bit of a shared decision-making model that starts to really even think about cost and affordability as part of that. And then really starting to help patients find the information they need. Some of it is you'll have frequent flyers that have been through the healthcare system and know everything about their health plan, but there's other folks that don't even know where to start and don't even know what some of the main terms are, say deductible versus co-insurance versus copay versus other sort of key terminology. And so it may just be helping in very simple ways at the beginning of helping to answer questions, helping people to know that there are options, helping to know that helping people think through what some of the terms mean and how they might start to find the information, even if they don't necessarily know exactly the answer right now. Just the simple help of pointing people to resources in terms of, well, your insurer will have this type of information that should be able to help you, or that this might be these places you want to look. I think there's a lot that can be done on a simple level that we heard in our panel that can really make a big difference.
Absolutely, and I think you kind of hit the nail on the head in saying, you know, this is really just the beginning. We've got a lot of work still to do, and I've been excited to see for all the people who've been participating in the webinar today, sharing some other programs and resources with us. We'll work to get those up on our website. If there's other programs that are doing some work in this area, please do share those with us. You can send those through our website. You can send them directly to me at agibson@PCPCC.org. Well, we are at the top of the hour, and I want to thank both Rob and Melissa so much for an excellent presentation. Again, just to remind you all, within 24 hours, we will have this posted up on our website, so you'll be able to download the slides. You'll be able to hear the conversation. So I encourage you to share that with your colleagues and friends. And please do participate in our briefing next month. We would like to invite you to register ahead of time to be a part of that. And then, of course, we hope to see you all in person here in Washington, D.C. in November at the PCPCC annual meeting. So thanks again, everyone, and have a great afternoon. Bye-bye.